Hello, I'm Dr. Chasity Brimeyer. I'm an associate professor of anesthesiology and a pediatric pain psychologist in the Jane B. Pettit Pain and Headache Center. Today, I'm going to provide a brief overview of my research on postoperative pain care. I'm investigating psychosocial or psychological supports for youth undergoing Pectus repair surgery, and this project is funded through our department's seed funding grant. Research shows us that about a third of patients undergoing major pediatric surgeries like Pectus repair go on to develop prolonged postoperative pain. And prolonged postoperative pain uniquely predicts poor health and functional outcomes like excessive school absences, increased healthcare utilization, and other functional disabilities. So postoperative pain is a really important surgical outcome to target for intervention. One contributing factor of prolonged postoperative pain is pain catastrophizing, or the tendency of patients and or their parents to be unable to stop thinking about the pain, anticipating the pain, feeling helpless to address or manage the pain, all of which cause the patient to experience pain more intensely. To reduce the risk for prolonged postoperative pain in patients undergoing Pectus repair, I developed a single session intervention in 2018 that provides patients and families with pain education, or an understanding of how pain is produced in the body, a variety of pain coping skills, and parent-based tools to best support their child. And while we have great qualitative evidence that my intervention was perceived as very beneficial and satisfactory and had high acceptability in patients and parents who used it, in general, prolonged postoperative pain remains an understudied problem in pediatrics. There isn't a lot of research on the clinical utility of these interventions, so my current project involves establishing evidence of my intervention's clinical utility using standardized measures. This project is part of my overarching goal to identify evidence-based interventions that reduce the risk for poor postoperative outcomes like prolonged pain in youth undergoing major pediatric surgery. So specifically for this project, we are randomizing patients into two treatment groups. We have a passive control group that will just receive the intervention materials. It's a handout, a booklet that I created with all of the coping skills, and an intervention group that will see me for the full single session intervention and also receive the materials. Patients and caregivers will complete a pain catastrophizing scale and additional measures that capture factors known to impact the pain experience, such as pain intensity ratings, and they're going to complete those at key time points. So baseline, or when they're recruited for the study, post-intervention, or immediately following their visit or receiving the materials, post-op day 1, and finally during the first week of discharge via text. Our main outcome is pre and post-intervention change in patient and parent reported pain catastrophizing. I would not be conducting this project without receiving funds from the seed funding grant through our department. The grant funds have enabled me to support a research coordinator who recruits for the study, biostatistician services, and printing the intervention materials on high quality paper. And then in the future, any publication costs will be covered through grant funds. The study is ongoing. We're currently recruiting and we'll evaluate and publish data after that. When completed, we hope to use this project to pursue extramural funding for a larger scale study of clinical efficacy of the intervention. Before closing, I would like to extend my heartfelt thanks to Dr. Hainsworth. Without her support, I literally would not be able to do this project. Her assistance has been invaluable in completing the grant application and actually just conducting this study. And I'd also like to thank Kevin Barrage for his recruitment support as the research coordinator. Please don't hesitate to contact me at either email address with any questions or follow-up comments. In closing, the Department Seed Funding Grant is a wonderful opportunity for clinically focused providers to be able to conduct research, and I encourage others to apply for the grant. Thanks for the opportunity to share my project.